This conference will now be recorded.
Good morning, students. I am audible to you. Any one of you answer me?
Yes, sir.
Okay, thank you. So we are in toxicology, and we are going to discuss about a simple topics there. That is the food poisoning, still poisons, and we are last time we finished the asphyxiants and gas poisons. Now come to the we are discussing about the simple topics of food poisons, and previously they are giving in the food poisons botulism and Blepharospam, but these topics are you are already again you will discuss in the microbiology also through the microbiology textbooks also, that is about the botulism and Blepharospam also. So come to the food poison. So what are the poisons? So poison means already you know anything food or whatever it may be, you are taken in a unlimited quantity or any, that means you are taken in a more count, that means it is crossing the limit. Anything is act as a poison. That means even food also acts as a poison if you are not you are taking in a unlimited or more of its limit. So food or water also a poison when you are taking the depends upon the dose, more than its dose, like that. So now come to the food. Foodborne diseases or food poisoning is the common infections by the infectious or by the children's or anyway in the hostels, especially they may be contaminated with food, and infections and as well as the infestations. So now food poisoning also known as the foodborne diseases. So according to the WHO, the disease usually either infectious or toxic in nature, caused by the agents that enter the body through the ingestion of the food. So along with the food, when you are taking the food, along with the food, they will enter into your body by ingestion. So we can call it as the foodborne disease or food poisoning. So major health burden worldwide leading to high morbidity and mortality. According to WHO, globally more than 3.5 billion cases of infective diarrhea reported annually, of which 70% are mainly the young children caused by the contaminated food and water. Especially the children studying in the hostels, especially hostels, and whatever maybe the hostel the children are reading. So they will be suffering. 70% of mainly young children caused by the contaminated food and water, isn't it? So the foodborne diseases mainly affect the 70% mainly in the young children. The common in summer because of the warm temperature favors the multiplication of the organisms. Foodborne diseases will be common in the summer because of the warm temperature favors the multiplication of the organism. So come to the next. The pathogenesis of the food poisoning. So food poisoning caused by the microorganism or either toxins are most often manifest with the GI symptoms, which varies with the severity and duration of the taking the contaminated food. So the microorganism, maybe bacteria, or whatever it means, microorganisms or are the toxins most often manifest with the GI symptoms. In addition to bacteria, viruses, and parasites, the food poisoning also caused by the contamination with the chemicals, pesticides, and toxic substances present naturally in the food, like toxic mushrooms and fish, shellfish. These are also fish, but they have the toxic substances whenever taking the directly the food. Toxic mushrooms or fish and shellfish, they will release some chemicals or toxins released into the body. They may lead to the food poisoning and symptoms. So in addition to bacteria, virus, and pathogens, along with the food poisoning also caused by the contamination with the chemicals, pesticides. This is the food poisoning, or whenever a person want to take a suicide, they may be mixed with the food, mixed with the chemicals mixed in the chemicals or pesticides and toxic substances present naturally in the food, like toxic mushrooms and fish, shellfish. So come to the next. The transmission of the pathogens and toxins to the people, the transmission of the people, pathogens and toxins, the food production and processing, and food preparation and handling, and improper storage. So the food poisoning, when it how it transmits to the transmission of the pathogens and toxin to the individual. But the transmission routes are, first of all, the food production and processing. It is the contaminations are there. Food production there is a chance of the mixing of chemicals, or food production process there is a chance of the contamination, or with the toxins released in this, or maybe mixed with any other chemicals. And food preparation and handling. So handling of the food by packing out or making of the food, they may cause the contamination by the toxins, and improper storage. So some already store at a warm temperature 10 to 50% is okay. That means it may lead to the contamination. So the food will be contaminated with the toxins. Improper storage, because of the improper storage, may lead to the food poisons. The three process transmission is possible. And now go to the food poisoning. Two varieties. Foodborne infections. That means it's caused by the consuming the foods or liquids contaminated with the bacteria. See, directly the food is contaminated with the liquid, contaminated the bacteria, viruses, or parasites. They may be entered into the body by ingestion. Directly, the virus or bacteria parasites may be infect the person. This is the foodborne infection. So invading the parasites, also viruses, they may be invading and multiplying in the lining of the intestine and the tissue. Whenever, along with the food, the virus or bacteria, they directly enter into the body by ingestion, and they may invade in the and multiplying in the lining of the intestine or tissues. So that's why they may be lead directly cause the symptom signs related to the GIT system, and invading and multiplying in the intestinal tract and releasing a toxins, the bacteria only. So maybe toxins. So there is a two varieties of the food poisoning: foodborne infections and foodborne intoxications. So foodborne, directly the bacteria, virus are contaminated in the food and they may be ingested, will lead to the directly they enter into the body and maybe cause the infection. Foodborne. Now, by foodborne intoxication, it is caused by the consumption of foods or beverages already contaminated with the toxins. Along with the food, that means directly the virus or bacteria, they will enter into the food, may lead to the infection. But here the food already contained the toxins released by that type of things, may lead to the foodborne infection. Source of toxins are certain bacteria, poisonous chemicals, or natural toxins found in the animals and plants. They may be contaminated. So here directly the food is contaminated with the toxin released by this bacteria and poisonous chemicals. So the foodborne infections, first one, and second one is the foodborne intoxications, isn't it? It is clear. Okay, now come to the what is the foodborne infections and intoxications. There are difference between the foodborne infections and you have to so copy this. And what is the first of all the cause for the foodborne infections or foodborne intoxications? So directly the bacteria or virus causes the foodborne infections, but the toxin released by these bacteria and other chemicals can lead to the intoxication. The mechanism is invading, and whenever taken by ingestion, the bacteria or virus they multiply within the lining of the intestine. So, but here the toxin already directly released, so no such a direct effect the toxin. The toxin itself causes the symptoms and signs and symptoms of this infection. So incubation period is hours to days. Why? Because it will take to multiply and they may release the toxin or like that. In case of the foodborne infection, it takes hours to take. But already the toxin released in the intoxication. So minutes to hours it will may cause the foodborne infections, food intoxication. So the signs and symptoms will be start in the hours to days in case of the foodborne infections are diarrhea, abdominal cramps, nausea, vomiting, and fever. So related to the GIT, and here in minutes to hours the signs and symptoms will appear: the vomiting, nausea, diarrhea, and double vision, and weakness, respiratory failure, and numbness, motor dysfunction. So these are maybe depends upon the type of the intoxication toxin or type of the virus or bacteria. It maybe depends upon the symptoms will be appear. The transmission can be spread person to person via fecal-oral route. Why? Because directly the parasites or virus or bacteria may be infect the person. So they may cause parasites and they may cause transmission from the spread to the person. But here the toxin is released in the food, so no such a transmission from the food intoxication. So no more transmission to another person. The toxin itself causes the person who taking the food only, they may be suffer. The factors related to the food contaminations. So inadequate cooking and cross contamination, poor personal hygienic and bare hand contacts. And here the intoxication, inadequate cooking, at improper handling and temperature. See, inadequate cooking and cross contamination, especially the food infections, foodborne infection in hotels. Suppose the person who are serving the food, they may be contaminate the foods, so it may cause the foodborne infections. That's why in number of hotels or restaurants, the people who are serving the food, they have to test for the any infections first. The doctor will have, you have to give the certificate is a non-infectious, especially salmonella, typhoid. These they will come to the, they will send the group, that restaurant owners or whoever it may be management, they will send the people who are working in the restaurant or hotels, they will send to the doctor and they will take the doctor certificate from this. Then only they will be join the people in that food restaurants. Otherwise, they have the infection, they may be contaminate the people, and poor personal hygienic of that person may cause the infest the who are coming to the guest, like that. And at the same time, food intoxication, inadequate cook. Suppose the person the food will be properly cooked, they may have that killing the virus or bacteria, but or parasites, what it may be. So if you properly cooked, it may be a damage. That means they will be remove the bacteria or virus, so toxins. So it will not cause the intoxication. So suppose if inadequate cooking and improper handling may and temperature may lead to the intoxication. So factors related to the food intoxication, foodborne infections. And come to the what are the important pathogens which may cause the foodborne infection, whatever it may, foodborne or foodborne infestation or infections. What are the major important pathogens? That's why I'm telling you, I have to go through the microbiology textbook also, because the foodborne infection they may be given properly, and you have to search for in this microbiology textbook. So the important pathogens are bacteria, especially Escherichia coli, Staphylococcus aureus, and Salmonella species, and Campylobacter and Vibrio cholera. And Clostridium and Shigella species are the most common pathogens which infects the person by the food poisoning process. The virus which causes the food poisoning are rotavirus, hepatitis A virus, and hepatitis B virus, and the protozoans, especially Histolytica and Lamblia, Giardia lamblia, Toxoplasma gondii. These are the protozoans which may infect may cause the food poisons, and the nematodes and Ascaris lumbricoides and trichodes. And the cystodes are Echinococcus and Taenia solium. The trematodes which cause the pathogens in this food poisoning are trematodes are Fasciola hepatica, and the animals are catfish and dragonfish. The plants are mushrooms, and chemicals are insecticides and pesticides that accidentally may be mixed with the food chemicals, or maybe they are taken wantedly by the suicidal. may mix it with the food and causes this food poisoning, the chemicals. So you have to remember the bacteria which is causes the food poisoning, and viruses, protozoans, and nematodes, cystodes, and trematodes, and animals like catfish and dragonfish, as well as the plant food poisoning and mushrooms and chemicals. These are the important pathogens which cause the food poisoning in the humans by taking or ingestion of the food, isn't it? So these are the food poisons, pathogens which are caused. Now come to the in India common bacterial food poisonings. Commonly, Indian food poisoning are due to the bacterial food, due to the salmonella typhi, especially. Main the bacterial food poisoning is due to the salmonella typhi and staphylococcal species and the clostridium and bacillus cereus. These are the common bacterial food poisoning, or you can remember. And come to the types of bacterial food poisoning, you can see the mechanism and the location and illness and examples of this bacteria which causes the food poisoning. So the bacteria which causes a non-inflammatory, and because of they will be released the enterotoxins and which causes the food poisoning. They may not cause the inflammation at the that means intestinal gouge, whatever it may be. So the location which causes the introduction is the proximal small intestines, and illness or watery diarrhea. They may cause the watery diarrhea in this. And examples for this non-inflammatory poisoning caused by the enterotoxins released by this bacteria, Vibrio cholera, Escherichia coli, Bacillus cereus, and Staphylococcus aureus, because they are non-inflammatory and they may release the enterotoxins, which leads to the watery diarrhea. They impact especially the proximal small intestines, so it may lead to the poisoning. And the bacteria which cause the inflammation at the site of the impact, they will attack the colon and distal small intestine, especially the cytotoxins and invading is there, and which causes a dysentery or inflammatory diarrhea. So watery diarrhea, the holy water is there, and dysentery means they will mucus and the infection. The diarrhea with the fecus with the mucus with the dysentery, especially. They are caused by the first of all, there is the Shigella species you are remembering. Shigella causes the dysentery, and the Salmonella and the Eugenic and the Parahemolyticus. Parahemolyticus. These are the species which causes these types of bacterial food poisoning, and the bacteria which may be penetrate the distal small intestines, penetrate and enter into the distal small intestine, and may lead to the illness or food poisoning or salmonella typhi. They may be cause the enteric fever. Enteric fever. So these are the mechanism by which the bacteria will be entering into the body, may lead to the illness, or there are the non-inflammatory and inflammatory mechanism and the penetrating mechanism by the salmonella typhi. Isn't it? Talk about what are the incubation period and the cause and symptoms which leads to this, and what are the food materials that may be infects these food poisonings. So the incubation period is very important to differentiate the cause of organism to lead to the food poisoning, and the same symptoms appear within the so to know the diagnosis, that means what is the cause for this, especially. So you have to remember depends upon the incubation, especially we will remember what is the cause for this food poisoning, and we will have to treat the differential diagnosis first. So first of all, see, whenever the person taking the food ingestion within 1 to 6 hours, they may cause the nausea, vomiting, and diarrhea. These are the symptoms will be caused by this salmonella type. Sorry, Staphylococcus aureus may be caused, and Bacillus cereus. These two bacteria will cause the signs and symptoms within 1 to 6 hours. So the food materials that may be infect this Staphylococcus aureus is the poultry and eggs and salads and the cream crackers. So and suppose Bacillus cereus may be contaminated through the fried rice. Here remember the signs and symptoms will be appear within the 1 to 6 hours. So the causative organism may be, you have to probable diagnosis will be Staphylococcus aureus and bacillus. Suppose the signs and symptoms when after taking the food. So in marriage couch or in hostel couch, what is the group of the people when they are taking the same food and suffers with the signs and symptoms may be most probably food poisoning. In that, within 1 to 6 hours, attend to the party or go to the restaurant or whatever it may be, 1 to 6 hours if you get the signs and symptoms, they cause it due to the Staphylococcus aureus and bacillus cereus. Depends upon the incubation period. So now 8 to 16 hours, the constituted perfringens, and bacillus cereus may be caused abdominal cramps and diarrhea, and it is due to the ingestion or taking the beef, poultry, legumes, grains, and meats and vegetables. These are the 8 to 16 hours may cause abdominal cramps and diarrhea. Is it a procedure? Perfringens and bacillus cereus. These are organisms which cause the symptoms within 8 to 16 hours. So you can say that is the diagnosis. Now come to the more than 16 hours. What are the causative organisms which cause the signs and symptoms in the food poisoning are Vibrio cholera and etc. Toxins is Clostridium, ESC, and the next come to the Salmonella species and C. jejuni and Shigella. These are the organisms ETCC, enterotoxic releasing Escherichia coli, and there is a hemorrhagic Escherichia coli. Hemorrhagic symptoms ఉంటాయి EC అన్నప్పుడు. So these more than 16 hours may cause the signs and symptoms Vibrio cholera, enterotoxic Escherichia coli, and hemorrhagic Escherichia coli, Salmonella species, C. jejuni, and Shigella. So more than 16 hours after taking the food or ingestion of the any type of the food may cause signs and symptoms means you can assess conclusion come to this are Vibrio cholera and ETCC and Salmonella species and jejuni and Shigella. So what are the signs and symptoms by the individual? Suppose if it is a Vibrio cholera, after 16 hours they lead to the watery diarrhea, and that is maybe ingestion of the shellfish and water, they contaminate the shellfish and water. So ETEC, the water diarrhea may be occur, and the salads, cheese, and meat may be contaminated with this, and bloody diarrhea seen into hemorrhagic. That means Escherichia coli may cause bloody diarrhea, which may be infects the. So the common foods that means that affects this are the common foods due to the Salmonella species are inflammatory diarrhea is there. That means the common food are affected through the poultry, beef, eggs, and dairy products. So you have to remember these tables. You have to by head these, and you have to remember it. And egg, salad, and potato may be due to the contaminated with Shigella and may lead to the dysentery. So you have to remember the incubation periods, especially 1 to 6 hours, 8 to 16 hours, and more than 16 hours. And it depends upon this incubation period, the causative organism will be decided by this. And definitely we will go for the microorganism. We will test for the organism which is causative, which cause the food poisoning also no doubt. But depends upon the incubation period, you can divide this organism which cause the food poisoning. Now go to the food poisoning. What is the treatment for the food poisoning? In generally, what is the food poisoning? So definitely they have the vomitings and the diarrhea like that. So they will be, first of all, they will be dehydrated. The people will be going to dehydration, loss of fluids from the body. So you have to first treatment is definitely hydration. The number of fluids you have to give to the patient first to replace the fluid loss. Hydration is the first treatment in case of the food poisoning, where the person may be lost the fluids from the body. So by through the ORS and IV fluids you have to give, and antibiotics for the treatment for the bacterial disease or anything. You can give the ciprofloxacin, ofloxacin, any antibiotic, broad spectrum antibiotics you have to give, and ORS and IV fluids. Okay. And in case of the food poisoning, there is a mortality is very less. Okay. and if you treat within time. So why? Because the immediate symptoms are there, and because of the vomiting sensation and the diarrhea, definitely the patient will have the symptoms, external symptoms will be, but definitely immediately they will join the hospital, and the mortality is very less in these cases. So come to the person who died in case of the food poisoning, we had brought to the casualty. So after that, they will be brought to the mortuary, the death of the person. If you do you take the clinical history as well as the requisition report from the police people and come to the conclusion. And if you do the postmortem finding, of course, postmortem, you will get the symptoms like this. That means findings in the stomach, especially. The mucosa of the stomach and intestine is swollen and intensely congested due to this information, whatever it may be. The organs can be isolate in the viscera and blood and sent to the for examination to the microbiology and the FSL also. For the FSL, especially for the chemical analysis, any food poisoning with the food infestation, and you can send for the organism with the microbiology and pathology, you can send it. Why that you can assess what is the causative organ, isn't it? So food poisoning treatment they have to remove and autopsy findings. So what is the food poisoning and what is the medical legal significance of this case? So most probably the food poisons are due to the food poisoning is due to the mass that means especially hostels or any marriage functions and in restaurants. So because of this, the mass food poisoning in the marriage functions, midday meal programs of the schools. So they have to give the what is the causative organism, which it may be due to the negligence of the management or whatever it may be. So it will give that means medical legal significance in that. Poisoning from the hostels or restaurants should be reported to the public health authorities and the homicide case where the poison is added in victims' food deliberately. So homicides cover definitely have to inform the police people, and that to section IPC 272 adulteration of the food and drink intended for the sale. So maybe it may be punished under section, that means 272 IPC adulteration of food and drink his deals under section 272 IPC. And 273 IPC is the sale of noxious food or drink. There are restaurants especially ఇప్పుడు ఎక్కువగా number of restaurants they are booked or they file the case on restaurants because of this type of the noxious food they are sale, and they may cause the food poisoning for the people. So they will be file a case against under section of the 273 IPC. 272 IPC adulteration of the food and a drink intended for the sale, and 273 IPC sale of the noxious food or drink. So the punishment for these two sections, the person who are involved in this case here, imprisonment up to the 6 months or fine or both. They will be cancelled their that means contracts and you are they will be cancelled this. So punishment especially imprisonment for the 6 months and fine. So our forensic significance, you have to remember the section 272 273 APC. Punishment for the 6 months or fine and both. For restaurants, whatever they may not follow the rules and regulations of this or hygienic only. So they may be file a case and against them and they will be fined. So how to prevent this food poison? So automatically you can say the maintain the hygiene personal as well as the kitchen area. The maintain the hygiene of the personal, I already told you, that means who are working in the kitchen area, that means especially restaurants hostels who are cooking persons, they have to maintain the personal hygiene in the kitchen. So that's why they have to test for the foodborne infections. You have to test for it, salmonella, test for before that. You have to take the doctor certificate for that person, and they have to they will allow to the cooking. Maintain hygiene, a personal and a kitchen area, and separate utilization of the raw and cooked food, and proper and thorough cooking. So proper cooking, most of the bacteria will be killed. So and parasites, salmonella, that means Taenia solium, and they will be improper beef. They may be transmit the food, Penia solium, Penia acerata, like that, parasites and infestations. So if you properly cook it, and they will be cleaned up and are dried. So next, proper storage. Don't leave the cooked food at room temperature for more than 2 hours. The cooked food at room temperature more than 2 hours. After that, you should not use that food, isn't it? And next, refrigerated cooked food below 5 degrees. And don't store food for the too long period in the refrigerator also. So they may cause the intoxication similar to or infection. Use safe water. So contaminated water also maybe transmit this bacteria and will lead to it. So first of all, maintain the hygiene of the persons who are involved in this serving of the food or making the food, and the separation of the raw and cooked food, and a proper and thorough cooking, and proper storage, and use of the safe water. So these if you maintain all these things, you can avoid the food poisoning, or you can prevent the food poisoning first of all. After that, if anything is going on, you have to treat the patient for food poisoning by the hydration, giving the fluids and as well as the antibiotics, and maintain the ABC like this. Depends upon this. So come to this. These are the general aspects of the food poisoning. What are the causes of the food poisoning? What are the incubation of the period? What is the treatment for the food poisoning? And how to prevent the food poisoning? These are the introduction of the food poisoning and everything. Now come to the what is the food poisoning, that is especially you can see botulism. Botulism is a serious infection and they may cause the contamination of the food and make the food poisoning. Here see the Clostridium botulinum is the main organism. The botulinum toxin is one of the most powerful toxins in the world. So a rare but personally fatal disease. So if it is infected, most probably cause the fatal disease. It is intoxication, not an infection. The toxin released by these organisms may cause the this botulism, not the infection. So normally they are present in the soil or dust and intestinal tract of the animals. They may be in pests. Others. The toxin used for the treatment of the Blepharospam. This is the medical use, that is a surgical. In our medical field, they are used for this treatment aspect of this toxin also, isn't it? The use of this toxin is Blepharospam, treatment of the Blepharospam and strabismus and risus sardonicus and Botox surgeries. So in this is a medical use. Medical importance of this toxin. They will be used in this. How to remember? These are the entrance question they are used in this. A toxin used for the treatment of the Blepharospam, strabismus, risus sardonicus, and Botox surgeries. So the botulism may be there are the three varieties of botulisms are there: foodborne, food botulism. The botulism toxin which contaminate the food with the toxin, that is a food botulism. And the wound botulism, whenever the person may be wounded or they may cause the injuries in the accidents or homicides. The wound which remain open and may be infected with this botulinum toxin that is present in the dust and whatever it may be, they may cause wound botulism. Or especially in among IV drug users also they may be infected from person to person. The wound botulism. And infant botulism is in less than 6 months of age of the children or infant may be infected with the bacteria grow and produce the toxin in this person. These are the three types of the botulisms, that is a food botulism and the wound botulism and infant botulism. So you remember the botulism and the laterism and the next another topic that is we will discuss. These are the important food poisonings in our forensic aspects. They will ask in this botulism, especially the laterism, they will ask in this 4 marks questions. So with this general aspects, we finished up this food poisoning. We will discuss later. That is the food remaining individual foods, botulism, laterism. We will discuss in the next class. So we will discuss in the next class. Okay, all of you can leave.